Hi guys, how is everybody doing? Welcome back to Dr. Gilead Show. Today is May 11, 2017. We're back on Dr. Gilead Show. We are on WBGR Radio and also on Facebook Live. So you can reach us on WBGR Radio 301 429 9247. 301-429-9247. You can call in and ask your questions and also make contributions. We are also on Facebook Live, Dr. Theo Oswala, MD. You can also send us a tweet. Today we're going to talk about cocaine use disorder. Cocaine use is a big one. The use of cocaine is very common. Today we're talking about cocaine use. Now, I would like us to always do this. Please do not use what you hear on this platform to make a diagnosis of yourself or someone else. Please do not use what you here on this platform to treat yourself or someone else. It's always good to consult a trained personnel, a physician, who can make the appropriate diagnosis and give you the appropriate treatment. Dr. Gilead Show, the producers, the host, cannot be held responsible for what anybody does based on what they hear on this platform. So please, it's always good to make the right move, get the appropriate diagnosis and treat yourself. You can call in on 301-429-9247 to ask questions or make contributions. Today we're talking about cocaine use, the use of cocaine use disorder. So, cocaine is what we call an ester alkaloid that is found in leaves, the coca leaves. These are plants that are found mostly in the Andes mountains, mountain region of South America. So that is from a coca leaf found in South America. Now, this was also, as a matter of fact, manufactured to be used as a local painkiller. But, you know, as usual, people would always get something out of something else to do what they want to do. These days, cocaine is one of the most dangerous drugs known to man. It's one of the most dangerous drugs that man has ever produced. It is, and it's very hard to get off from it. Once people start using cocaine, it's so hard to get off it. So I tell my young people who come to my clinic, do not touch it. If you've never touched it, do not even attempt it. Somebody sees you and says, hey, take a hit, and say, no, I'm not going to touch it because it's hard to get off. And also, today we know that cocaine is a worldwide multi-billion-dollar business. People move it from one part of the world to another to make good money. But it's not legal. It's very dangerous. So I always encourage people, do not go near it. Do not even touch it. Cocaine is so well known worldwide out there. It has different names. Some people call it C or Coke. Some call it Flake. Some call it White Boy. Some call it Dust. Some, different names. Nose Candy, Charlie, Sniff. Different names. So it's always good to know what names these drugs are called on the street. So when people are talking about it, you will know what they're talking about. Sometimes people sit there and they use names that you're not familiar with, but if you know these names, you will be quite aware of what they're talking about. So it's always good to have a good idea of what they're talking about so that you can be more informed. Now, how is cocaine used? Cocaine could be used nasally, it could be snorted, it could be smoked, and sometimes people, to get a quicker high, prepared into intravenous form and given IV. Some even put it in the mouth and ingest it orally. Some rub it on their gum. So these are all different ways that people use cocaine. And it's whichever way you use it, it depends on how people want to use it and how fast they want to get the hit. What is the prevalence? How common is cocaine? How much is it used worldwide? Approximately 18.2 million people worldwide have used cocaine at one point or the other in their life. 18.2 million. That is not a little number. That is huge. Now, and that is about 0.4% of the world population. Ages 15 to 64 use cocaine. You can imagine it's not a small number. Now, 3% of current users in the U.S. are teenagers, 12 to 17-year-olds. So 3% of people who use cocaine in the U.S. are about 12 to 17 years old. But the good news is that cocaine use has declined fourfold in this age group. So it has really declined, I think, from information from health education, substance abuse education. So more people are seeing the dangers and people are staying away from it. So there's a decline, fourfold reduction in the number of young people that use cocaine. That is very significant. If you look at 12-month prevalence by age group, that is, if you look at over a year period by age group, the number of people who use cocaine between the ages of 12 to 17, 0.2% of them use cocaine. So 0.2% of adolescents, which is ages 12 to 17, use cocaine. And above 18 years, about 0.3%. Now, but the biggest number, margin, people who use it are 18 to 29 years old. So that is young adults. It's about 0.6%. That is a huge number. That would tell you how many people use cocaine overall in that age group. And among the races, different races in America, Native Americans have the highest number of cocaine users, about 0.8%. Different from what most people would think. Most people would think that African Americans, black people, use more cocaine than anybody else. That is not true. You have the highest number of people who use cocaine in America are Native Americans, and that's about 0.8%. And African Americans is about 0.4%. Hispanics 0.3%, Caucasians 0.2%, but the lowest users are the Asian and Pacific Islanders. They're very low, 0.1%. And if you look at the male-female ratio, more males use cocaine than females. About 0.4% of males use cocaine, and 0.1% of females. Now, use of cocaine is known to be most common in North America. And this is followed by South America, then Europe. Now, it's less used in West and Central Africa, East and Southern Asia, and also in Eastern and Southern Europe. That they don't use it much there could be either due to supply and not necessarily demand. So it's most likely that is either too expensive or the dangers of being caught. And in some places like Indonesia and Malaysia, if you're caught with cocaine, is death sentence. Even in some other areas, Turkey, you're going to die. So I think that's one of the reasons why is probably lower in those areas. So why do people use cocaine? What does cocaine do? Now, in our brains, we have different chemicals, what we call neurotransmitters. Like I explained before, neurotransmitters are the chemicals in our brain and our central nervous system that help transmit information. The effect of some of these neurotransmitters can it occurs differently. Some will make you happy, hyperactive, give you a lot of energy. Some will make you depressed. But it's known that cocaine increases the level of dopamine. Dopamine is one of the chemicals, neurotransmitters that enhance mood. Also, it's known that cocaine increases serotonin as well as norepinephrine. Serotonin is the neurotransmitter. When it's low, people feel sad and depressed. And that is understandable why people self-medicate with cocaine. Some people who are depressed, they feel sad, they are in bed all day, they have no drive, no motivation to do anything, and somebody says, hey man, I got something for you, take this white something, sniff it, and they do it for the first time. They have so much energy, they got their life back, they jump out of bed, they find out that in the next 15-30 minutes they can do a whole lot. They say, whoa, this is the treatment that I've always looked for. They do it, and because the half-life of cocaine in the body is so short, so they do it, they feel good, and 30 minutes to 1 hour, they're back to square one. So they keep doing it and doing it and doing it, and they get addicted to it. So, because cocaine increases dopamine level, as well as norepinephrine and serotonin, it gives you some energy, and people feel a little better compared to how they were feeling before. So there are some positive psychological effects due to its action on dopamine. You feel good, you feel happy, you have energy. Cocaine also has some local anesthetic effects. So people, when they do cocaine, they feel numb. So if they were in pain, both physical or emotional, that is gone, that is blocked. That is short-lived. It's so short-lived that you want to do it again. You want to use again and again to stay in that state of perpetual happiness or high feeling or numbness. That is a dangerous thing about cocaine use. Now, how soon do people feel high or feel good once they do cocaine? It depends on the route. If they take it by IV or by sniffing, by inhalation, the effect is almost immediate. But the problem is, once you inhale cocaine or you inject it IV, it goes out of your system real quick. It lasts about 15 to 30 minutes. So you take a hit, immediately you feel good, 15 to 30 minutes, you're lower than where you were before you did the cocaine. So the onset of action by IV and inhalation or sniffing or snorting is very quick, but it goes out of your body real quick too. But when it is injected, when it is chewed or put in the gum, it lasts a little longer. It could last up to 1 to 3 hours. So, depending on what people do, it could last a little longer. Now, when you do cocaine, how soon can it be found in your system? How long can it stay in your body? When you come to my office, I do your urine or I do your saliva, or in some labs they take your hair. How long would it last? If the blood is drawn, it could still be there for 2 days. Even though the effect is out of your system, the metabolites will be there. So if the blood is drawn, you can still find it within 2 days. But blood draws are not common unless when they are in the emergency room or any of that. If urine is done, which I do very commonly in my office, you could still pick it in within 2 to 4 days, on the average of 3 days. So urine toxicology, you will see cocaine metabolite in the urine for up to 4 days, so on average 3 days. Sometimes if you use it for a long time, continuously, it can still be picked up within 10 days. If your saliva is taken, it could still be seen within 3 days. But if a strand of your hair is picked up, it will still be there for about 90 days, 3 months. So you cannot do cocaine and you have a job interview, or they want to do a drug testing before you get a new job, and you say, oh, okay, I can do it and go for the testing in 1 week. No. They're going to take a strand of your hair and test it, and the cocaine will still be there. So it stays up to 1 month, 3 months on your hair. So you need to know that and be careful. I'm not encouraging you to play some tricks at your job, but you have to know that it could still be there for 3 months. So let's look at the symptoms of cocaine intoxication. So when someone does cocaine and you meet the person, someone you knew before, what are the things that you may notice? Number one, cocaine gives increased energy. So it gives you this rush of energy. People feel tough, people feel strong, they feel they can do a lot, they can conquer the world. It gives you a huge energy, a burst of energy. It also makes people very alert. They feel they're sharp, they can see clearly, and they're more sociable. So it increases your alertness and sociability. People are more open, more talkative, more likable, because they make fun, they become the center stage when they are in a group of people, because they are high, they have high energy, they are alert. Now, it also brings elation and euphoria, which is a very high level of happiness, more than usual happiness. Someone you know who is usually withdrawn, quiet, not talking much, after a hit of cocaine, they're so happy, they're so elated, they're so euphoric. And that is why people self-medicate on it, because it gives them that feeling of high, that feeling of happiness, which is a good experience though. So people want to do it and stay that happy all the time. People who are fatigued all the time, tired and draggy, cocaine decreases that fatigue. So it gives them a burst of energy and they feel good. Sometimes, or a lot of the times, it causes decreased need for sleep. And that is, you don't want to sleep. You stay awake. That's why people who do cocaine can stay awake all night, all day, getting high. So it causes decreased need for sleep. Also, it causes what is described as intense pleasure, intense pleasurable feeling. And people have termed this as total body orgasm. That there is this intense feeling of happiness all over the body. And people who have done cocaine will tell you that it's a kind of total body orgasm. They feel so good. And that's why they want to continue to do it. But even though they have these good feelings, let's look at the things that cocaine does to your body, the symptoms, the physical effect of cocaine on our bodies. Number one, it increases our heart rate. It causes tachycardia. Your heartbeat will go from normal of 70, 80 to 150 beats per minute. The heart is racing. You think you're going to get a heart attack. And actually, people have gotten heart attack before. So, is something that is common. So people can get heart attack. People can get because the heart is beating so fast. Sometimes, after some time, the heart rate can drop to very low, bradycardia. It's not uncommon, but the commonest way is tachycardia, increased heart rate. The pupils will dilate. The eyes will all be shining, and that is called pupillary dilation. So the pupils in the eyes are so wide open. It also causes elevated blood pressure. The blood pressure will go so high, and that is why sometimes people get a stroke, or people get a heart attack. People will perspire, will sweat a lot, and when the sweat dries, they feel chills, they feel cold. They could have nausea and vomiting, feeling like you're going to throw up. Some people actually throw up. And there is no drive to eat, decrease in appetite. So what happens, because they're using cocaine day in, day out to feel good, there is no drive, no appetite to eat, so there's severe weight loss. So that's why when you see that sister who was doing so well, and in 1 week she disappears, comes back very skinny, that brother has lost so much weight because they've been getting high all day, all night, they're not eating. So there is severe weight loss. Cocaine also causes severe, what we call psychomotor agitation. That means they are so agitated, they can't sit still, they can't sleep, they can't lay down, so they are running up and down, walking the streets. I had a patient recently, after doing cocaine, he was clearly butt naked, and he was walking from one point to the other until the police came and said, "Hey man, what's going on with you?" He would not respond. He was just hyperactive, looking all over the place. The police got him, covered him up, took him to the hospital, and he was treated. So it makes people hyperactive, psychomotor agitated. They are very, very agitated. They get angry for no clear reason. Cocaine can also cause cardiac arrhythmias, and that means the heartbeat is beating out of rhythm. It's beating so fast and so out of place. And when that happens, you could form a blood clot in the heart. That blood clot can be pushed out of the body to the brain, and it could cause a stroke or a heart attack. So that is arrhythmias. And the heart can stop, actually. It can have a myocardial infarction, a heart attack, and the heart can stop because it's beating so fast and so irregular that it could stop. People have died. The other things cocaine can cause, it could cause confusion. People are completely confused, disoriented. They don't know what they're doing. They're running all over the place, confused. People also have had seizures, grand mal seizures. They pass out, they're shaking, and they've been picked on the roadside with severe seizure attack disorder. They're taken to the hospital. Severe muscle stiffness. The muscles get so tight, the legs, the abdomen, and people can also slip into coma, and of course can die from it. There are other things that could happen with cocaine. People could withdraw. The withdrawal symptoms are so bad that you just got high, feeling so good, and the cocaine goes out of the body, they become so depressed. They have what is called psychomotor retardation. They are so draggy. If their mood was here before, they drop lower than where they were before they did the cocaine. And they are so fatigued, they're so tired because the muscle has been tight, they've been so hyperactive, running all over the place. The brain has been kicking, and once the cocaine is out of their system, they're so fatigued, they're so tired. Sometimes they could have hypersomnia, that means they sleep too much. Or but sometimes because they're so tired, they cannot sleep. They have insomnia as well. Another sign of withdrawal from cocaine is increased appetite. That's why when they are admitted into the hospital, they clean out from cocaine. They want to eat and eat. They eat everything because one, they haven't eaten in a long time. They've been starving all day, all night, getting high. So when they withdraw from the cocaine, they want to eat and eat and eat. That's all they want to do. Sometimes they also may be agitated from the effect of the long-term effect of the cocaine. So these are some of the symptoms of and signs of cocaine intoxication, and also the withdrawal. This is not uncommon, it happens a lot, so we have to look out for it. Oh, I can see Victoria Cole, thank you for joining. And also Ulama, thank you for joining. That's she's joining all the way from Nigeria. Wow, thank you for joining. We are on WBGR Radio and on Facebook Live. Today we're talking about cocaine use disorder. We will take a short break at this time. Stay tuned, don't go away. Stay tuned to Dr. Gilead Show. Don't go away, please.
Life insurance. Life insurance you can use.
Yeah, that was him calling. He said you never text him the information.
And she was able to use a portion of her life insurance benefits.
He's gonna try to make it though. I told him where it's at.
Instead of worrying about bills. Does my insurance policy do this?
He said, yeah, he's supposed to text me the information. He didn't text me where it was at.
2045 to receive a free DVD.
That sends it to him.
Living benefits can benefit you that you need it most. My brother had a stroke. He's finally getting better. He was able to get money from his life insurance now it covers medical expenses. Does my insurance policy do this? If you've had a critical illness, some life insurance plans let you take advantage of your benefits while you're still alive. Does your insurance
Make commercials you want to do.
Forecast Financial now at
Make commercials you want to do.
1-800-678-2045 for your free DVD. Don't wait until it's too late. Call 1-800-678-2045 today. That's 1-800-678-2045. Forecast Financial. Plan for the future now.
It's the new, all-natural, family-friendly pharmacy, Family Choice Pharmacy, located at 8313 Annapolis Road, New Carrollton, Maryland. Family Choice offers alternative medicines as well as discount programs you can easily enjoy. Come be a part of our family at Family Choice Pharmacy, as every family should know their pharmacist. If you're looking to join the family today, you can reach us at 301-577-1212. Family Choice Pharmacy.
All right, guys, welcome back to Dr. Gilead Show. Today we're talking about cocaine use disorder, which is big at this time. Very, very serious. It's almost an epidemic, but we just found out that there is a fourfold decrease among our young ones, our teenagers, which is a good thing. So we've talked about the symptoms, the signs, the withdrawals. Let's take a look at the adverse effects of cocaine use, the bad effects of cocaine use. People get high, feel good, feel happy, but there are bad effects of cocaine use. Number one is people who do cocaine end up having severe panic attacks, severe anxiety attacks, panic attacks that is really very troubling. That is number one. Now, people who do cocaine, they find themselves very irritable, very, very irritable. They are always angry for no clear reason. They're irritable, they're unhappy. The only time they're happy is when they're high. So irritability is very common. They have sad and dysphoric mood, very sad, because when you're high, very high, feel good. Then once the high is gone, you feel very, very depressed, very dysphoric, very sad. That is the after effect. Now, they also, another adverse effect is psychotic symptoms. So people who do cocaine, when they are high, they hear voices or see things. They're delusional. They're thinking that people are out to harm them or do something to them. They're paranoid and they're suspicious. I saw a guy one day, and after getting high, he was all over the place and he was just looking. And, hey man, you okay? He wouldn't even give an answer because everyone who talks to him, he's suspicious of them. He thinks they're out to get him. He's paranoid. It is a very bad adverse effect, and those are some of the reasons why you don't need to do it. You don't need to do it. Some people feel so grandiose. They feel that they are all important. They feel they can conquer the world. they have poor judgment, and they delve into things they would not normally do if they were not high. That is one of the dangers of doing cocaine, and that's why people do cocaine and they end up committing suicide. They jump out from buildings they wouldn't otherwise do, because they're looking from an 8-story building. It looks like it's just very close to the ground floor. They think they are invincible, they are grandiose, they think they are superpowers, or they think they can fly, like the man who has wings or something, or Superman. So these are some of the dangers. Of course, they have impaired judgment, psychosis, and delusional. Now, the other things are, sometimes they feel like there are insects crawling under their skin, cocaine bug, and this is, they feel like something is crawling under their skin, insects are crawling, and so they're itching all over the place, they're scratching their whole body, and when you look at their skin, they have all that scratches just because they are itching, they have the cocaine bug. This is very common. It's a crawling sensation under the skin. Now, because people are high, and when they get up, they feel so dysphoric, and two, they use all their money to stay high, they feel hopeless and worthless, and a lot of people commit suicide. So usually, what they wouldn't have done if they were sober, they do it because they are high at that point. They can't think and reason properly anymore. They've lost everything they have with everything they have to buy in drugs. They pawn their cars, or they pawn their radio sets, everything. They sell off their cars just to get high, and they just wake up one day finding out they have nothing. Family has left them. They have no job. They have no money. They don't feel like life is worth living anymore. And of course, the dealer will not sell to them anymore. They end up killing themselves. Suicide is high in those that use cocaine. Now, what are the physical complications? So there are different complications. The one we talked about are some of the psychological complications. The physical complications of cocaine use are high blood pressure, hypertension. Because cocaine makes your blood pressure shoot up, people have sustained hypertension, which can result into other medical problems. The other complications are heart attack, myocardial infarction. When people are high on cocaine, their heart is beating so fast that the heart at a point can no longer cope. And once the heart cannot cope anymore, it will stop. It will stop working. That is one. Two, also, the heart, the blood supply to the heart is narrowed, or it's constricted. So the blood supply is cut off. You get a heart attack. The same thing happens in the brain. They can get a stroke because the blood pressure is so high. Blood vessels in the brain will rupture, and they have a bleeding stroke. Sometimes because they have arrhythmia, the heart is beating out of rhythm, so they form blood clots, and the blood clots can travel through the arteries to the brain and lodge there in the brain, so they have an obstructive stroke. So different complications. Now, people have also had seizures. Seizures, both grand mal seizures, and people have picked them on the wayside, on the roadside, seizing, and they're taken to hospital. Also, because cocaine increases blood pressure, tiny blood vessels in the brain rupture. Over time, they end up having memory problem, severe cognitive impairment, because every part of the brain where the blood supply is cut off, that part of the brain goes atrophic. That means that part of the brain dies. Once that happens, once that part of the brain dies, they have memory problems, they have a decline in the brain function. When people who do cocaine IV intravenously, what happens, they have, they could get infection because they don't clean up properly. They get infection, and if they share needles, they have, they can contract severe viral infections like Hep C. Hep C is very common right now. So if you're doing cocaine, in as much as I say don't do it, if you have to do it, please do not share needles. Use your own needle because you can contract hepatitis C. Hep C can end up causing liver problem and even liver cancer. So it is something that really we need to work on. Please do not use do not share your needles. Use your own needle. Don't share needles because you can contract a lot of diseases. That is one. Two, people can also contract HIV. HIV is very common, even though it's no longer a death sentence. People get treated, but you don't want to be exposed to a virus that you cannot get treatment for. Also, chronic cocaine users can get stomach ulcers, and this is because the blood vessels to the stomach, to the gastrointestinal tract, could rupture, and they bleed, and perforations happen. They develop ulcers. That is another complication. The other complications are liver damage. People have had liver damage from cocaine use, so we have to be watchful about that. Cocaine also, even though initially it works as an aphrodisiac, that is, it increases your sex drive, but at the end of the day, it impairs sexual function because the individual is so debilitated, has no drive to do anything. At the end of the day, they have severe decline in their sex drive. So it is a very common thing. We have to be very careful so that we don't get any of these side effects. For females, it impairs the menses, the menstrual flow for the females. It impairs the function. People don't have their menses as monthly as they should have. So it affects your sexual organs, affects your cycle, and initially it may increase your sex drive, but at the end of the day, it causes more problems. We have other social complications. When people are high on cocaine, they have poor judgment. They cannot plan. So what happens is they make mistakes. They take more risky behavior. They drive a car. How can you be driving a car at 120 miles an hour? You're going to wreck. You're going to crash. And you're going to get killed and also kill other people. So there is poor judgment when people are high on cocaine because they can't make the right judgments anymore. They do things out of character for them. Other social problems they develop: poor relationships. People who had good relationships with girlfriend, boyfriend, a spouse, wife, or husband, or partner, as the case may be, they can no longer relate to them because, one, they're spending all their time at cocaine joints, getting high all day. They won't come home. Nobody wants to have a wife or a husband who is getting high all day. So they have relationship problems. At their place of work, they have major problems as well. So it is a major problem, and people have all kinds of issues. So cocaine use is a big problem, and it's something that we really need to stay away from. We have.
Let's take a commercial break.
Okay, all right. We're going to take a very short break, and we have a guest, a special friend of Dr. Gilead's show. He's coming in to join us. So we'll take a break. Don't go away. Stay with us. We'll come back shortly.
Yeah, I'm like walking my cameras. Okay, now you go, man. Get set up. I gotta get set up. You want to sit here or there?
Yeah.
Okay. That good enough for you, man?
That's good.
Okay.
Come here, man. Come here.
Log on to the website at or call 301-572-0404.
Come here, me a little bit.
That's
All right. Don't go too bad.
So I just want commercial. Here we go. 10 seconds.
And let them know you heard about them on WBGRsports.com.
5, 4, 3, 2.
All right, guys. Thank you. Welcome back to Dr. Gilead's show. I have a special friend of Dr. Gilead's show. My very good friend, my brother Barry. Barry Champ is a very good friend of ours. He is. This is blocking his face. Okay. Yeah, he is a good friend of ours, and he lives in the community. We invited him to the show today. Barry, you're welcome to the show.
Well, thank you, man.
Yeah.
I
So,
appreciate that.
all right. So say hi to our audience.
Hey, audience, how are y'all today?
Okay. So Barry is a well-known man in the area. He knows a lot of people. He knows what we're talking about today. And if you live in the area, you will know that cocaine use is a major problem. Barry, we're talking about cocaine use, which is a huge problem in our communities.
Wow.
So, and I know you've seen somebody who did coke before.
A lot of people.
A lot of people. So when people do cocaine, why do they do cocaine though?
They do came back for the fun
For the fun.
and for a runaway.
A runaway.
Okay, they do cocaine just to get away from the situation that they're in, and cocaine has believed that they are having fun. All right, doing something that they like to do with a group.
So you see that what I was saying. So they think that they're doing something for fun. But the getaway Barry's talking about is, hey, they're depressed or they're feeling low.
That's right.
So they find something that gives them a little kick. That is the problem. But that is not the solution though.
That's not the solution. See, cocaine is like a hypnotic. Okay, it's not like heroin or ecstasy or anything of that nature. Cocaine is a drug that make you believe that you need it.
Mm-hmm.
Okay, it's not a physical addictive drug. It's a mind addictive drug.
Yes.
If you choose to like to leave it, I mean, you have no consequences physically or anything of that nature. You could just walk away from cocaine. But, like heroin, heroin is a physical addiction. You have to get hospitalization to walk away from that. But cocaine, it's just a mind-controlling drug, okay? Combined with the situation that you're in or the people that you hang out with, and things of that nature. I mean, cocaine is easily to walk away from. You got to choose just to live another type of life, okay? And it won't even change. I mean, I'm just saying, you won't have no physical retractions or
some withdrawal and all that.
you don't have none of that.
Yeah.
You got to choose to say, hey, I'm gonna hang out with B, that's cocaine, or I'm gonna hang out with C, which is another life.
Right.
And that's what you have to choose.
And I know in our communities, you and I have talked about this before, about how our young people are doing cocaine. So what can you tell our young people who have never done it before?
Now stay on your track, man. You know, cocaine is the fun of people that's not gonna ever have anything. Okay, you gotta have a mindset that I want something out of life. Okay, you know what I'm saying? You have that choice. A lot of people in our neighborhoods that, you know, that they think they have nothing to live for anyway. They don't think they can able to achieve the heights that other people can achieve. You want to stay within your comfort zone. Say, for instance, if you're living in a project, you want to stay in that comfort zone. You don't want to leave that comfort zone. You know, but I'm here to tell you today, I've left that comfort zone to go out into the world and deal with people in corporations. I've been working for corporations like MCI, EDS, IBM, you know, but I'm coming from Southeast, Berry Farms. Okay, you know, you can do it, but you gotta want to do it.
Right.
Okay, you just don't want to just live in your comfort zone, weed and cocaine and all that stuff. Then you go home. You know, you want to live another type of life.
But you know, we know that sometimes the dealers, they know where to go. They push it to our projects where our brothers and our sisters are hanging out because they know that we don't have jobs. They push it to our neighborhoods. And how can we stay away from it? Because these things are pushed to us.
Education, man, and you know, knowing that you have another life that you can live. Okay, that's the biggest thing.
Yes.
Knowing that you have a life that you can live. You don't have to look at your neighbor and say, they into this stuff, so I may be into this stuff. You got to look at your neighbor and say, hey, I don't want to be into this stuff.
Right.
I want to step outside of Berry Farms, go get me a good job, like a computer job, and make $100,000 a year.
You were doing that.
Yes, I was. I mean, you know.
And you're retired now, so.
You know, I was doing that, and I
Yeah.
came from that type of neighborhood, and I got into some things. I wasn't no angel.
Well, no, we're not perfect.
Okay, you know what I'm saying? I'm no angel,
Yeah.
man. You know, you growing up, you're a teenager,
Right.
you know, you're living life, you know, you're chasing, you know, male, you're chasing the girls, and the girls are fooling you. You know what I'm saying? But, you know, you got to choose another life, man.
Right.
You know what I'm saying? Early on. And the good thing about, I'm going to say this, the good thing about cocaine is that it doesn't addict you physically. You can choose to walk away from it, okay, without having no type of repercussions or anything of that nature. Okay, you can choose just to walk away from it.
But that is if you don't have complications already. You know, like before you came into the studio, I've been talking about some people do cocaine and they get a stroke. And they have all kinds of deformities. Some guys get a heart attack, they die, but some people get a stroke, they're paralyzed on one side or their mouth is twisted to one side. But I have seen, you know, you know me very well. In my office, I've seen people who did cocaine and they're looking perfect. So these are lucky people, survivors. Don't go back to it, you know?
I mean, yeah, you can have a stroke, you can have a heart attack,
Yeah.
you know, and it's probably preceding by what you're doing.
Right.
Okay, it's not preceding that you walk away from it.
Right.
If you walk away from it, you know, you don't have those symptoms. But if you doing it every day,
Yeah, you
okay,
will.
you're doing it every day, all day,
Mm-hmm.
you know what I'm saying? You are subject to having a stroke, having a heart attack.
Yes.
Okay, because one thing about cocaine it does do, it speeds your heart rate up.
Yes.
Okay, you know, you go into heart palpitations,
Yes.
and what that is, your heart starts to beat too fast.
Yes.
Okay, so, you know, I mean, and I know whoever's out there have had this feeling if they're doing cocaine.
Yes.
Especially if they're doing processed cocaine, which is the rock.
Yeah.
Okay, you know, you're smoking a rock, and you know sometimes your heart gets to doing like this here. And then you know, I mean, you know, if you can't, if that don't stop you from taking cocaine, then you know, you're going to have somebody in your life that's a real deterrence for it.
Right, right. So before you came to the studio, I was talking about the social complications, the problems people face, and I talked about how people take risks and unnecessary, you know, do things that usually they would not do, and how it affects their relationships with family, with wife and and you know, children and all that. And how do you think this is affecting our brothers and sisters in our neighborhoods?
Man, you know, they caught into that little whirlwind of neighborhoods, okay? You got a lot of people in neighborhoods, like I said before earlier, they don't want to leave their situation. They are scared to take a step out of their situation. They don't want to, they want to take a step out of Parkland, okay? You know, they're like, okay, I don't want to take a step out of there, you know what I'm saying? I want to stay, I don't know what's going to happen to me if I go out downtown working for the world, man, working, you know, for a big corporation. How am I going to be able to just do this? Now, cocaine this is why they put it in the neighborhoods. I'm not trying to be biased, but you know, mainly the black neighborhoods. Okay, I mean, if you look at and read and look at movies, they tell you, you know, they want the darker population to smoke this stuff. That way, there will be no competition to the lighter, you know, the lighter folks. That way they can keep you down. Okay, it's a game. It's a game, and it's politics. You know, it can go further all the way up to Congress. But you have to understand, okay? And a lot of y'all young folks, you know, now today, you know, haven't had inspirations from black leaders and things like that. Yeah, we had a black president, and thank God we did. But you haven't had to deal with, you know, haven't had the inspiration from a Martin Luther King, a Malcolm X. You know, you haven't had inspiration from these guys. And by me being born in the 60s and raised in the 70s, I had, you know, influence from these guys. And our parents today don't teach these to their children.
Right.
Okay, they don't teach this stuff to their children. Okay, so you have to look it up for yourself. See what we have struggled to get to. You know, something like, you know, had to ride the back of the bus or drink from the dirtiest water fountain and things like that. But see, you guys, y'all got a chance to make a really big difference.
And you know, that is one of the reasons why I push this show, teach people on some of these topics, so people would know that these things are there. They happen to everybody. But you know, Barry, the statistic is, people think a lot of black people do cocaine, but the highest number of people who do cocaine are Native Americans. Yeah, not. It's just that, you know, we see our people, but we are not the worst. It's all over the place. But hold on there. Hey, I see Fala, Aaron Newby, Miss Knott, thank you for joining. Today we're talking about cocaine use disorder. Cocaine use disorder, and we're looking at the effects, how it works, the difficulties it causes. And today we have a very good friend of Dr. Gilead's show, Barry Champ, who is here with us. He's a good friend, lives in our neighborhood here. He has, you know, raised children. He has children, grandchildren, and we need to tell our young ones the dangers in doing cocaine. So Barry, let me ask you this: my experience is that a lot of people who do cocaine get in trouble with the law. And in the social complications, there are legal problems. Why do they get into so much legal problems?
That's a tough one, man. Basically, society don't want you to use drugs. Okay, you know, you go all the way back to the 20s where they had prohibition for alcohol. Right. Back then, they didn't want you to drink alcohol in the 1920s, but they figured that was going to stop happening. Society says, no, drugs are bad.
But drugs are bad, though.
Yeah, you understand what I'm saying? Society says drugs are bad.
Yes.
So basically, if you get caught doing drugs or carrying drugs or whatever the case may be, you're going to be pulled over, you're going to go to jail.
Yeah.
Okay, that's just the bottom line. Then you have to meet that judge.
But also, I think sometimes it's good to get the people off the streets, because when people are high on cocaine, they don't make rational judgments. Their judgment is impaired. They're driving too fast, and they can't think properly anymore. So I still think it's better to get them off the streets, but putting them in jail doesn't solve the problem. They should get treatment instead of getting locked up in jail.
Yeah, but you have some hard-headed people out there.
Right.
Okay, I mean, you can put them into a little padded doggone area where, okay, you got a burger, you got a dog, then we're going to feed you good, whatever the case may be. We don't want you to do drugs no more. Some people just like, okay, I'm going to bide my time and get back out there and do that thing. But when you go to jail, you meet that judge, okay, that's a different scenario. You stand in front of that judge saying like, hey, I'm going to use it anyway. Oh yeah, where the judge going like, okay, go out the back door. You going to come in the front door, you going to go out the back door.
Yeah. Okay,
and you're going to get a little time. Then she going to make you get treatment inside. So my thing is here again, it's about wanting to live the abundant life or wanting to live the what you call maybe safe life and stay into yourself.
Right.
Okay, just because you were born and raised in the hood don't mean that you have to stay in the hood. You got to draw, especially black men. And that's the target, black men. Okay, black men. Okay, you guys are the target. Let me say you guys, we guys are the target. Okay, you know what I'm saying? This is stuff like this is to hold us down. Okay, anything they can hold a black man down, they will put it out there. Okay, so it's up to you guys to carry the torch after we pass it on.
So, but it's for us too. I mean, the people who bring the drugs are black people. They come to our neighborhood. So we need to tell those brothers they should stop bringing the drugs to our neighborhood.
That's a kind of sticky situation.
Yeah.
Okay, I don't believe that the guys that bring the drugs to the neighborhood, okay, they out there trying to make money and struggle too. Okay, because they scared to get out of, the same situation that we're talking about.
Right.
Okay, so they like, okay, well, I don't have an education, so let me go sell drugs. It's up to the people in office to stop having this stuff come in here.
Come in. And that's true.
Okay, and it goes, people I say, and I'm not going to say this on, stuff rolls downhill.
Right.
Okay, and it runs from the president all the way down to society. Okay, this stuff, we ain't flying this stuff in here. Trust that. Okay, somebody's flying this stuff in here. It ain't us. Okay,
because we can't. We don't have the ability to do it.
But just know there's a different way. You got an education process. If you don't have no money, you can go to school for free.
Free, yes.
Okay, you know what I'm saying? You got to know what you want to do. You got to get in there and say, okay, I can do this. I can be a doctor. I can be a surgeon. I can do this. Instead of hanging on the corner every day, smoking down and drinking down.
Right.
You know what I'm saying? Getting your head buzzed up till you go home and do nothing.
Yeah.
Okay.
All right. So let's quickly. We're running out of time. How do we treat people with cocaine use disorder? First of all, when they are brought into the hospital or to see the doctor, we do a good assessment, get good history. Like find out how long you've been using, what you're using, how much you're using, and in what way you're using. And once that is done, get some urine testing and all that, then we sometimes, because when people are high, they're very dangerous, they're very aggressive, they may need to be admitted into the hospital. So that is whatever the outcome is. For example, if they are feeling suicidal, or sometimes people do cocaine, they hear voices or feel paranoid. I tell you, Barry, I saw this guy, and he was high and he was doing all that. I said, hey man, he would not want to talk to nobody because at that time he was so paranoid.
Yeah.
So what we do as physicians, as treating providers, we put them in the hospital, calm them down, give them some antipsychotics, and they feel well. But once they're doing okay, they have to go see somebody outside. Yeah. Run groups, do individual and group therapy, and that helps in managing the case. Sometimes, like I always say, when people are self-medicating because they're depressed, they're sad and all that, so they do cocaine. Once you treat the depression, then that need or that desire to do cocaine is not there anymore because they're feeling good on the medication that helps them. So, but that what would you tell parents or family members, wives or husbands, whose spouse or whose loved one is doing drugs? What do you tell them to do?
Don't give up on them. Okay,
Yes.
a lot of people say, let them hit rock bottom, and when sometimes rock bottom you can't get up from rock bottom unless you have a hand.
Mm-hmm.
Okay, my thing is with the system is that they pull them in the hospital, they get them on antidepressants and things like that, and then they send them out on their way. But where are they gonna go to when they send them on their way? They're gonna go at the same corner, whatever the case may be, where they started from before. Okay, we need a system out there to say, okay, we're gonna work on you, we're gonna get your depressants and we're gonna keep you in till you get off of the cocaine, and then we're gonna put you in a job situation, all right, where you can go to school and learn something, okay, that you can go and step forward, okay, once it's a step going into, rehab and everything, but you need to step forward to continue on, okay, you know what I'm saying? They need to take people in and, have a job placement or something where they can just go work a job, okay, then you got to teach them, you got to reteach them the things of society and how society works and everything like that. It doesn't just stop with the rehabilitation. It has to go on.
So what we're gonna do, we're gonna have you come back to the studio another time. We talk about, and from your ideas and brothers in the area, how can we help these people who we're treating? How can we help reintegrate them and help them out? So that will be a topic for another day. We're going to talk about that because it's so important. You treat somebody, they go back into the neighborhood where they were. You haven't really done much.
Same old, So, like I said, they need to step out there and brothers, be strong.
Yes.
Okay, that's another thing. Be strong. Know that you're strong. Okay, know that you ain't succeeding to anything. That you can be strong. Reach down into your manhood, your womanhood, and stand up. And do what you got to do, not only for yourself, for your family, for your mother, for your children.
And for your father, too.
And for your father.
Yeah, man.
Okay, I ain't leaving my... You know what I'm saying? For your father, your children, and your grandchildren.
Yes.
They got to look to you for positive influences.
Thank you very much. Hey guys, our time is up, but I just want to say thank you for staying with us on Dr. Gilead's show. We talked about cocaine use disorder today. And Barry, I thank you so much for coming on the show. We're gonna have you come back and we'll talk more about how to help brothers, and it's not just brothers. The cocaine use is all over the place. Drug use, we both white, black, Hispanic. We just have to talk on how to probably reintegrate them and rehabilitate them. But we'll bring you in back to the show another time. Thank you very much for coming. We appreciate
being with y'all.
Yes. Thank you very much, guys. Please tune in again next week, Thursday at 1 p.m. on Dr. Gilead's show. I'm your host, Dr. Theo Osuala. You can come to my office or call 301-577-9111. We'll give you an appointment and we'll treat you very well there. Thank you very much for tuning in. We'll see you again next week, Thursday. Thank you.